afternoon, everybody. I was just going to remind Dr. Tilson to go ahead and introduce herself because we forgot to do that the last time, and it's important. As you come up to the mic, we're live streaming this event, so just please be sure to introduce yourselves, and I'll turn it over to Dr. Betsy Tilson, State Health Director.
Great, and welcome everybody.
Once again, we're on the air with breaking news this afternoon. North Carolina health officials giving an update on the coronavirus as there are now more than 60 cases in the state, 14 of them alone here in Mecklenburg County. Let's listen in.
But the situation continues to rapidly evolve, as does our response. And the actions that we're taking now, as other states are taking, is so that we can slow the spread of the disease, and so fewer people get sick at the same time, and then we don't overwhelm our medical resources. And so a lot of the actions that you have seen in the past week or two are to blunt that curve. I also want to reiterate some things that Secretary Cohen said yesterday. And we know there's been a fair amount of confusion about social gatherings. What's the right number? What's the right length of time? And so the bottom line is for people to use good judgment and practice what we call social distancing, which probably people are now very aware of that term. That means staying away 6 feet from other people when possible. Wash your hands, wash your hands, wash your hands. Use hand sanitizer. Don't touch your face, and practice proper respiratory etiquette, meaning covering your cough with your elbow. At the same time, we also need to support those who are at higher risk of having complications with this infection. And again, we've said that in the past, that's people over 65 and those with underlying health conditions like lung disease, diabetes, heart conditions. And those people need to be extra vigilant and stay home to the extent that is possible. So we're also hoping that people think about your neighbors, think about your social networks. For those people in those high-risk groups, what can you do to support those people? Can you get groceries for them? Can you run to the store for them? How can we support those people? I'm also going to revisit testing because obviously that has been a big point of interest. And you will see as our posting on our dashboard this morning that we have 63 positive cases in 18 counties. And we know that more than 1,800 tests have been completed across the state. And I say more than because some of that testing is reflected at the state lab, but also as more and more of our commercial and university partners come online, we know there's a lot of more testing that's going on across the state. And as a reminder, though, the positive tests that we get are reflective of all the testing that we're doing in the state. Again, our state lab is just a portion of that. But as our hospital and commercial labs are testing, we are getting the number of tests from some of those, but not all of them. And that's why I said we know more than 1,800 tests have been done because there's a variety of settings that we're getting, and we're not getting all of those numbers at this time. Ramping up testing right now is an important in this phase that we are in. But this level of intensity of especially community-based testing will change as we move through that response. And so the importance of testing as we move through will be less important in the future. I also want to reiterate that the changes that we're making in our daily lives are hard. I think we need to acknowledge that this is really hard. Social interaction is what makes us human. And all this can really take a toll on our mental health. And so I just want to remind people that there is support that's available. You can look to our resources on the website, and also for us to all come together as a community and support each other as much as we can. With that, I'm going to turn it over to our Attorney General, Josh Stein, for some of his comments.
Thank you, Dr. Tilson. I am Josh Stein, the Attorney General of North Carolina. Dr. Tilson just went through a host of ways, steps that we can take to prevent the spread of this illness. We also have to prevent fraud and scams, because whenever a crisis like this occurs, there are bad people who will try to exploit people's fear, their desperation, their uncertainty to steal money. When the governor declared a state of emergency last week, that triggered North Carolina's price gouging law. It is now in effect. That means that it is illegal in the state of North Carolina for someone to sell a product that's important for life at an excessively outrageous price, an excessively unreasonable price. We have so far received 136 price gouging complaints, half of which have to do with groceries. The number 2 complaint is hand sanitizer, followed by cleaning products. We are in the process of investigating those complaints. We have not yet concluded that any of them violate the law. If we do so conclude, we will act quickly and aggressively to enforce the law against any price gouger exploiting people's fears. Other types of frauds and scams for people to be aware of are hucksters out there selling products, making promises that simply cannot be true. They were snake oil salesmen in the 19th century. They're snake oil salesmen in the 21st. I just got an email promising me a miracle cure. There are no miracle cures. Dr. Tilson will tell you there isn't a cure, there isn't a vaccine. Science is working hard to try to develop both of those things, but they do not exist. And if someone's promising you that, they are trying to steal your money. In addition to the miracle cures, we are seeing an increase in phishing and telemarketing robocall attempts. The phishing is a perfect example. The one that was promising a miracle cure that I received this morning, I don't think they were trying to get my money. They wanted me to click on an attachment so they could steal my personal information. That's what phishing is all about, making you click something that will create a problem and open up your personal information to criminals. But we also we've heard from our partners both here in North Carolina, the AARP, and our federal partners, the FTC, that there is a robocall scam going on where people are getting calls at home and being told by the local health department that they have come into contact with someone who has the coronavirus and that they must be tested before they can leave their home and they can sell the person a test. Obviously, the local health departments are not doing this and would not do this. So if folks get calls like that, we have a robocall report task force that we've already established to try to protect folks from these criminals. That is 844-8-NO-ROBO. If you get one of these calls, 844-8-NO-ROBO. A final type of scam that occurs whenever there's a disaster, whether it's a hurricane disaster or a viral pandemic, is people trying to exploit folks' charity. We want people to reach out and support our neighbors in times of need, but understand that just because you get an email from an organization that has a good sounding name, or somebody sending you a link on a social networking site about some people who are in desperate need of help, because you get that does not mean it is true. If you want to help, give money to the food bank, give money to the Red Cross, give money to organizations you know will put that money to good use. You want it to go to where you want it to go. You do not want it to line some criminal's pocket. If anyone sees any issues out there where they think there's a scam, or there might be a scam, or there is price gouging going on, we have a toll-free number. Our folks are still able to answer the phones, and that's 877-5-NO-SCAM, 877-5-NO-SCAM, or just go to our website, ncdoj.gov/price gouging, and we will be happy to investigate it, because our primary concern has to be about the public health. It has to be about keeping people healthy and well and alive. But we will not tolerate criminals trying to exploit people's fears to make a quick buck. Thank you.
Thank you, Attorney General Stein. My name is Mike Sprayberry. I'm the Director of the North Carolina Division of Emergency Management. Today, we are standing up North Carolina 211 as a resource for people to call for assistance related to the COVID-19 coronavirus. People with questions about COVID-19 can dial 211, and based on the nature of their question, they will be routed appropriately for an answer. 211 can help people with needs like food assistance, support for families, and other basic needs. If you want to stay up to date on COVID-19, you can receive information by text. Just text COVIDNC to 898-211 to get regular information updates via text. We've been seeing a surge of non-emergency calls at our state's 911 centers related to COVID-19. We want to remind everyone that 911 is for emergency only. 211 is a good resource for non-emergency calls. I also want to address concerns about grocery stores. The state has no plans to direct grocery stores to close. We know that everyone needs groceries. The supply chain to our grocers remains strong, and stores are getting regular deliveries and restocking. Please resist the urge to stockpile food or engage in panic buying. Leave some for others, especially those who can't afford to buy a lot of food all at once. Governor Cooper has requested a disaster declaration from the U.S. Small Business Administration. We expect to hear a response on that, possibly as early as today. If that declaration is granted, it will make low-interest disaster loans available to businesses that are suffering financially as a result of the outbreak across the entire state. Thank you very much.
Thank you, everybody. For the reporters in the room, if you would just please walk to the microphone if you've got questions. Thank you so much.
This question is for Dr. Tilson. How many drive-through labs do we have now in the state, or collection sites?
Yeah, so there's a whole variety of different, what we're calling alternative sample collection sites. Through some of our private partners are doing it on their own, some through our public-private partnerships, so we don't have a number, but what we are doing is connecting our providers through their networks so that they can then refer their patients to those alternative sample collection sites.
I just have two other questions.
Sure.
One is, are you going to request hospitals to stop elective surgeries anytime soon? We've heard of some hospitals stopping.
Yeah, and so we do have a very robust healthcare coalition, and with our health systems all coming together, as you have seen, several of our big health systems are already starting to do that, and so we'll be having a good partnership and coordination with our health systems.
So not at this time, but maybe?
Not at this time.
Right. And then the last thing is, are you guys considering bringing back like retired doctors and nurses to help with what might be a surge?
Yeah, obviously our healthcare workforce is something that we are, when we think about all of our resources, our healthcare workforce is one of those as well. And so we are thinking through all of our different possibilities to meet our healthcare workforce needs.
Thank you.
You're welcome. Thank you for the questions.
Dr. Tilson, first two questions. Thank
Yeah.
you. Just a logistics thing about the count. I saw that Durham County is now listing, according to your tally, 12 cases. I know that Duke University said yesterday they had at least 15 positive cases. Do you know if there some, what's the difference what's the reason for the differentiation there?
So again, these numbers change all the time, which is why what we're going to be reporting out every 24 hours on our dashboard is the numbers that we know as of that morning, because those numbers are changing all the time.
I'm sorry, follow-up.
So,
Do you know if does the 12 reflect any of those 15 that Duke reported?
So the 15 reflect, the 15 of our numbers reflect the 15 from the Duke. I don't know the other ones that you were, but I know the ones this morning reflect the 15 from Duke.
Okay.
Yeah.
Oh, and
Okay, you get that. I think the point is that when we start chasing
Yeah,
numbers,
I
they
know.
change so quickly that
it was
that's
just-
why every 24 hours we'll give you
Oh,
those
yeah.
updated numbers and it will take a while. They'll be out of sync for a little bit. That's why.
That's just confusing.
Yeah.
And I
Yes,
had something
exactly.
and I have something for Mike as well.
Oh, sure. Great.
We've heard some reports from first responders out in the field and local fire departments and such that are running out of masks and other materials to respond to people's daily needs, especially if there's a concern that there may be a coronavirus case in that area or potential case. What do you know about that, and what's being done to address it?
We do know that there are some issues in the supply chain for personal protective equipment. We're working, 7 days a week to try to address those. We're also obviously prioritizing who gets the PPE, with the top priority being healthcare workers and the second priority being our emergency responders. We've actually been still issuing PPE to emergency responders at lower levels, and also with guidance to help it last longer. And so we know that that's an issue, and we're working on it, and it's a shortage nationwide right now.
What's the acronym PPE, please?
Personal protective equipment.
Thank you.
This is a question for Dr. Tilson, I believe. England has recently included pregnant women in the high-risk category.
Yeah.
Do you have any guidance for that population?
Yeah, and somebody asked that question a couple days ago. I can't remember, but there is some now a little bit. There's some new data that have pregnant women now in that high risk category, and so we have that information on our website as well. And so again, thinking through. Again, same thing with our high-risk categories, 65 and over, underlying medical conditions, and then now we have now enough data to put our pregnant women in that high-risk category as well.
And what does that mean for expecting women?
Well, I think same thing we've also said for other high-risk categories, right, is that don't go out, making sure that you are doing the social distancing, washing your hands really well, all the same recommendations we're having for other people in the high-risk categories also applies for pregnant women.
Thank you. And Attorney General Stein, perhaps this is a question for you. I don't know if you've received or if the state has received any reports of people, businesses first of all, who are not complying with the executive orders, and then also people who should be quarantining if they're not complying, and then how is the state responding to those situations if they are happening?
I can't speak to the quarantine. I don't know if either of the others here can. As it relates to the executive order in terms of not attending gatherings above a certain size, or for certain businesses, restaurants, bars to be closed, a failure to comply would be a Class 2 misdemeanor, and that would be enforced by local law enforcement, either police or sheriff's office in consultation with district attorneys, local district attorneys. I am not aware of any violations or any arrests for violations. That doesn't mean that something hasn't happened that just hasn't come to my attention yet.
Okay. And then I also had a question about the number of tests being reported that have been completed. If you could just offer some clarification on that. I know that you were saying it's just a moving target perhaps, but I'm not very clear on why we don't have a specific number of tests completed, reported from the state lab, hospitals, and commercial labs.
Yeah, so by law, this is a reportable disease, so we have to report the positives. And as we're having more and more the good news is we're having more and more labs and health systems coming online. And so as we know if somebody's coming online, then we're reaching out to them, asking them if they will then start reporting out their negatives. It is not something that is required by law, but we're asking them to start reporting their negatives so we have a better idea of the denominator. And so we're working on that and getting more data as we go forward.
We do have one more question about schools as well. I don't know if any of you can answer a question about schools, if there's any sort of plan from the state right now, what would happen with these students if they cannot finish out the remainder of the school year, that's K through 12 and higher education?
Yeah, I'll take it. So obviously this is big on our radar, and the Department of Public Instruction is thinking through a lot, what to do with this 2-week period, and then what would happen if it needs to be an extended closure. So there's a lot of thinking and planning around what that might look like.
Thank you.
You're welcome.
Dr. Tilson, I just want to, ask some clarification questions on the drive-through testing. So can we expect more drive-through tests in the future? Are you guys involved in that, or is that left up to sort of individual healthcare facilities?
Yeah, so first let's be a little bit precise in our language. So what we're calling is alternative sample collection sites. And they might be in a variety of different places, and they are a way to then increase access to the samples, which then need to be sent to a lab. Right now, as I mentioned, that in the beginning part of this phase, having more of that community-based testing will be important so we can understand the spread of the disease. If and when we get to community spread, the importance of doing that widespread community testing will not be as important, and we'll think more about testing of some of our very high-risk categories, our long-term care facilities, our congregate settings. So we are in a phase right now of encouraging testing, but thinking through when we need that as we go forward. So exactly how many we need and when we'll be looking at and making those adjustments as we go forward.
So it's not like a super urgent need right now then, or high on the priority
I think what we
list?
want to be sure we're doing now is expanding access to testing, which we have been doing, and so you can see that we've had those more than 800. But just the expectation is that the need for that broad-based testing is important now, but won't be as important as we move forward. So understanding when that balances with the other, as you heard Director Sprayberry, that the personal protective equipment that is needed for sampling is also that same personal protective equipment we're going to need if and when people are needing more medical care. So it's a little bit of a balance of what do we need right now, and then when do we shift our resources to what we need as we move through this response.
So just to clarify, you guys are coordinating those efforts with healthcare facilities. You're not just leaving it up to healthcare facilities.
Yeah, so some healthcare facilities are doing it on their own.
Right.
We're helping to support where we need. So we're not trying to control. We want there to where our private sectors are doing it, but we are encouraging, but not controlling or putting them all up.
Can you speak to, do we know if anyone's fully recovered? I know our first case was March 3rd, but...
Yeah, so let's talk about that. A lot of people have said, let's think through the people that have gotten through this, right? Which is so important, right? And let's just iterate that the vast majority of people are going to get through this fine, right? And so, and now we have new clinical criteria that if you are 7 days after the onset of your symptom and then 72 hours without symptoms, then you're considered recovered. So although I don't have the exact status of all the different people, thinking about how long ago our first case was and we have no deaths, then that tells me those people now are recovered.
Yeah, so we can sort of do the math backwards from when we started getting our first cases reported.
Yeah.
Okay.
Yep.
And then in terms of, there's some discrepancies. I know like some of the Duke University students aren't being counted in that county. There's someone from Durham that's being counted in another state. How are you deciding where you count specific cases?
Yeah, so any North Carolinian will be in our count.
Okay.
And then if that person is in another state, that would be in another state's count.
Okay. Sorry, one more question. How many people are hospitalized at this point? Do we know?
Yeah, so as we're moving through, we'll know how many positives, and then we'll know how many deaths. Thankfully, no deaths, but it's going to be hard to keep track of exact clinical status of everybody. So we know how many positives and we know how many deaths, and we know those are two numbers that we can report accurately.
Right. So
we'll
we
be doing
won't
that
really
going forward.
know how many people are recovered or how many people are hospitalized.
Exactly.
at this
Yeah,
point.
those will just be hard things to track systematically. Yeah.
Okay, thank you.
Thanks.
Questions, I think, are for Dr. Tilson, but if anyone else wants to jump in, please feel free.
Okay.
Some of our viewers, their children have gotten messages from individual teachers stating that school will be out through a date in late April. Has any final decision been made on that?
No.
Okay. Is that a decision that the state will make, or is that being left up to the individual school boards?
So I think the question around school closures, as we said, was a really, really hard one, and made very much in partnership with the governor's office, with the Department of Public Instruction, with the school board of education. So as we go forward in potentially other recommendations for the school, I think what the governor had said is it'll be a lot better if we have a consistent policy across the state. So those conversations will be happening across all those agencies.
Okay. What advice, and I apologize if you've answered this in an earlier setting, what advice would you have to people in North Carolina who have traveled not out of the country, but maybe to other states where there is a more serious COVID-19 outbreak?
Yeah, exactly. Like, for example, New York City, right? And so what we were saying is that if you have traveled back from either a country or a part of the United States that has known widespread community transmission, then we ask you to self-quarantine, to be monitoring your symptoms, and then let your provider know if you have symptoms.
A couple of reporters have touched on this already. I just want to confirm. So you publish your totals every 24 hours.
Yes.
We get more continual updates throughout the day from the various county health departments.
Right.
Whose numbers do we need to be looking at?
Well, ours will give you that point of time and consistency every 24 hours. Obviously, we're going to be off. for the other person's question. We'll be off in the afternoons, but by giving you that daily count, then you will have that predictable cadence that I think will be helpful for you.
Has there been any discussion about any curfews or shelter in place or anything like that?
No, so again, this is rapidly evolving. You will see we have not been shy in having different escalating or different guidances. So as soon as we are, if and when we have different guidance, we will be sure that people know that as soon as we have made that decision.
Hi, Dr. Tilson.
Hi.
Hey, questions, a little bit more questioning about the testing. Okay, so based on the data that you've released since March 13th about the number of patients you've processed tests for, it looks like the state lab is averaging about 66 patients a day. Well, that looks like it's less than half of the 150 patients a day capacity we've been told the state lab has for testing. Why does that number look so low?
Yeah, well, we have a very quick turnaround time. We're turning around within the business days. So of all the tests that we're getting, we're turning around quickly. So we don't have a backlog. But also a lot, as I said, a lot of our other testing labs, commercial labs and university labs have come online as well. And so they are taking some of that volume as well. So it's just a matter now, I guess the good news is we have more capacity for testing, but we are turning around, our turnaround time in the state lab is within 1 business day. So we are processing everything that we are getting.
You're processing what you're getting, exactly, but that means that I guess the tests aren't coming in as quickly as
Well,
your
again, we are
capacity?
just one piece of the puzzle, right? And so there's a lot of other commercial labs and university labs that providers can also send their samples to. So we're just one piece of that puzzle.
Is the state still only providing 3 test kits at a time to county health departments?
So we are ramping up so again, these are sample collection kits
Right.
that we are sending out, and we are ramping up more of those supplies to the county health departments.
One more question for you. It sounds like the federal government is now dropping the requirement that you have traveled to a high-risk country or had contact with somebody with a known positive in order to get tested, going just now with the symptoms. Is our guidance here at the state level going to be the same?
Oh, we changed that guidance last week. If you look at our
You're on it,
guidance.
okay.
Yeah,
On
yeah,
top
yeah.
of it.
We're been there, done that.
All right.
Yes, so we're going with that. So I don't mean to be, that was a little casual, but our testing criteria are for the state lab. You do need prior approval for the state lab, and so those criteria are 1, contact with someone with a known positive, or fever and symptoms of a lower respiratory illness and flu negative, and that meets the criteria for testing.
I do have questions for you, Dr. Tilson, but I also have some for Director Sprayberry. So if you want him to go first.
Do me first,
Okay,
and then I'll go to my.
So just to address some of the things we've been hearing from the public, a lot of people asking about nail and hair salons, which remain open, although their businesses rely on close contact.
Yeah.
Should they be open? Is there been any directives given to them?
Yeah, I just got a text from my hairdresser yesterday. I was like, oh, that one's going to be hard. So right now we do not have plans to close nail salons. But again, this is a rapidly evolving situation, and we will continue to reassess.
And you sort of touched on this in the beginning. The term we've been hearing, flatten the curve. What's the most important thing people can be doing right now to flatten the curve?
Yeah, so, and I think there was a study that came out in the past day or two, some of you may have known, that this is going to need to be a multi-pronged approach. There won't be one silver bullet. Everything that we're doing, we're going to need to put together to flatten that curve as much as possible. Again, we want to flatten that curve. We want this to be a slow boil, and we want to be sure then that our medical resources, we have the capability to respond. So it's going to be a combination of, 1, a lot of that, the isolation and the contact tracing that our local health departments are doing, those containment strategies. They're still in place. We're aggressively doing our containment strategies. And then our community mitigation strategy. So everything that we've been putting out, that making sure our guidance on mass gatherings, our guidance on staying home, on not having social gatherings, all of those things that people can do, and it's hard, all those things that people can do for that social distancing, if we all do that together with our containment strategies, that's how we can flatten that curve maximally.
And then last one for you, Woman is what is the biggest concern for you right now as one of our state health officials?
Yeah, I worry about a lot. I think that in such a rapidly evolving situation, it is hard to get our communications out. It's hard for people to understand exactly where we are, and so trying to have that clear communication, that clear guidance so everybody knows their roles and everybody can respond. That's one of our biggest challenges when things are changing every 24 hours in order to be able to communicate so everybody understands where we are and what their role is. And so that's why we're very grateful. And one of the reasons that we really want to be doing these daily media is that people know where we are, know where we're changing, what are we to today, so that together as a community we can all work together.
Thank you. Director Sprayberry, you mentioned that the state has no plan to close grocery stores. What do you say to people who we know are lining up outside these stores, in essence almost like tackling each other for toilet paper and things like that? Because that does seem to be a concern that we're hearing from people.
And we understand that is a concern, but I would tell you, just like I stated before, the food supply and the chain of supply for food is working well, and the grocery stores are getting restocked. So try not to do panic buying. Understand that there's folks out there that can't stock up at one time, and so they're buying from week to week. And so just refrain and calm down. You know, we're in it for the long haul, and so this has just begun. And so we're not shutting the grocery store down. People have to eat, and so I think that the stores are in good shape. We understand there has been some run on toilet paper and other commodities, but we'll work through that as we go through.
And then my other question, I know the focus a lot yesterday was on restaurants that are going to need help. What about, you spoke about this already, but the small businesses that are really worried about what their future is going to look like?
Yes, ma'am. So once we get this Small Business Administration disaster declaration, it'll be for the entire state. And it's a economic injury disaster loan assistance declaration. And so every county will be eligible for it, so that means businesses in all the counties will be eligible for it, and they can get up to $2 million, and they can have up to 30 years to pay back a loan. And for a business, it's 3.75% interest, and for a nonprofit, it's 2.75% interest. So these loans will be made available as soon as the disaster gets declared. We were very pleased yesterday. We submitted the request. The governor submitted the request. It was actually submitted last week. There was some more information based on some new policy. This is a new type of event. We were on that pretty doggone quick. We got it down to Atlanta last night, and they actually pushed it up to SBA headquarters last night. So we're very hopeful that that disaster is going to be declared very quickly.
Thank you very much.
Yes, ma'am.
Question for Dr. Tilson, then one question for Attorney General Stein. We touched on this earlier, but what sorts of resources is the state making available on the mental health side of things? First of all, for people who are dealing with this in their homes, and also in particular for people who are working in the healthcare industry.
Yeah, that's a really, really, really great question. And so on our website, we actually have a page for our behavioral health providers, and also on what people need to know. We also have behavioral health resources. We also have a toll-free call line that people can call for some behavioral health resources as well. So this is one of those. This is a scary thing, an anxiety-provoking thing for a lot of people, and so we want to be sure that those resources are available, and you can those resources are available on our website.
On the price gouging cases that you mentioned earlier, is this more coming from, for lack of a better term, third-party vendors, i.e. not major retail chains?
It's a combination of the two. We're seeing people with concerns about prices they're seeing at brand name retailers, but we're also seeing complaints about sale of Purell on eBay or Amazon. And so we have to go through and actually investigate each complaint and determine whether it's valid. Just because a price has increased does not mean it is necessarily price gouging. There may be a reason why the price increased. Maybe the retailer had to incur greater expenses to get that product to the shelf to serve the community, just like Director Sprayberry was saying. These retailers, we should all be very appreciative about how hard they are working in order to ensure they're fully stocked, because a lot of our neighbors are in a moment of panic. And when that happens, they make decisions that aren't entirely rational and buy too much of a certain product, which then just upsets the next 2 or 3 people in line behind them. And so our retailers really are our frontline first responders in this, and we all need to be appreciative of the hard work they're doing. But that doesn't mean every time a retailer is raising their prices, it was justified. That's why we have to investigate.
Where is the line? And particularly if somebody's looking at this and going, I wonder if I need to report this.
Yeah, the line is unreasonably excessive. That's what North Carolina law says, which is not a bright line rule. A person seeing a dramatic increase in price will not know whether it was justified. That's why we urge anyone who's concerned about potential price gouging to let our office know. Very easy to do it, 877-5-NO-SCAM or ncdoj.gov/price gouging. Then we can investigate and reach out to the retailer and find out if there was a valid justification or not.
I'm not sure if Director Sprayberry or Dr. Tilson would be the best person for this question, but I just wanted to follow up on shelter in place. We have cities and counties across the country that are issuing shelter in place. What would it take for North Carolina to do that, or other counties in the state to be doing that?
And again, this is a rapidly evolving situation. We're continuing to assess what we need to put into place, and we will make further recommendations as we go forward.
Is there anything in particular that would move the state to issue a shelter in place?
We're continuing to figure out what we need to do and changing recommendations as we need.
Okay.
Great. Thank you. Last question, Lara.
So I wanted to know if you guys, Dr. Tilson,
Okay.
if you have any guidance for mobile health clinics, outreach workers, folks who are doing sort of mental health emergency responding at home or in the community at this time. Like, is it different than like being in a clinic, or is it not? And do you guys have specific guidance for these healthcare providers?
Healthcare providers who are doing
Like mobile healthcare, who are like, say, going to your doctor, going to your home.
It would be
caring
the
for
same
you.
recommendations whether or not you're doing healthcare within a healthcare site or healthcare more mobile. Yeah. All right, great. All right, well, thank you all very, very much.
All right, you've been listening to a press conference here out of Raleigh, the North Carolina Coronavirus Health Task Force. Couple of things to go over here quickly, and then we'll get back to regular programming. She mentioned that the numbers are changing all the time throughout the day. We get a number update every morning, but then that number continues to change throughout the day. But they did mention 15 positive cases independently at Duke University. So they were asked, how do I know that I'm over the coronavirus if I were to get it? Well, she gave a very revealing answer here. You'd be sick for roughly 7 days of illness, and then 72 hours without symptoms is then considered recovered. By the way, Attorney General Josh Stein was talking about price gouging a lot in and out throughout this press conference. If you want to report price gouging, and price gouging is defined as an excessive jump in the price of a product, the number to call here in North Carolina is 8775-NO-SCAM. Again, that number 8775-NO-SCAM is how you can report price gouging here in North Carolina. We're going to monitor what's going on in Raleigh, and we're going to monitor what's going on in Columbia and South Carolina as well, because this is really a Carolina situation as well as a national situation. We'll have the very latest updates for you coming on the news at 4. I'll see you then.